Why I wear protection, and you probably should too. When you walk into a hardware or supply store, there are usually one or more aisles of personal protective equipment, PPE, available. For those who get our hands dirty to get the job done, using such equipment becomes routine. Whether knowledge is obtained through apprenticeship, training, or applied logic, we have learned to take preventative actions to ensure safety or reduce risk. There are different grades and styles of PPEs for individuals. Whether they are chasing large paint jobs, woodworking, dealing with potentially hazardous chemicals, or healthcare. But has anyone ever suggested that you wear PPEs while cleaning your poultry pens and tilling your soil, or you could start coughing blood, go blind, or die? No? Well, golly. I'm glad you found us. As we all know, infants and those living with weakened immune systems are vulnerable and susceptible to infections, so naturally, this is a concern for that population and can be fatal. Yet this is also a caution for those living in highly contagious areas, sifting debris and disturbing the soil. This blinding, lurking danger is a microscopic fungus that primarily affects poultry keepers, farmers, landscapers, gardeners, renovators, demolitionists, construction laborers, roofers, exterminators, and spelunkers. After contaminated soil is disturbed, the antagonist becomes airborne, traveling hundreds of feet, showing outbreaks after construction and renovation activities. The first two documented urban outbreaks coinciding with construction were in Indianapolis. The initial wave correlated to the demolition of an old amusement park and the erection of a tennis court. Then again, after the University of Indiana added on an aportorum. Both waves resulted in 200,000 cases, 300 hospitalizations, and 15 deaths. An article in the New York Times archive highlights an incident of this exposure with the eye-catching headline, "A flu-like illness at Ohio school is linked to Earth Day project," stating that there was a massive decrease in attendance and reports of ailments within 3 days of a school project to clean up their courtyard. The 1971 article also says officials closed the intermediate school 2 weeks later, because 354, or 40%, of the 6th through 8th grade students and 27% of their teachers went to hospitals or stayed home with complaints such as coughing, headaches, vomiting, muscle aches, chest pains, and poor appetites, while also stating that the Schoolyard Earth Day project tackled 20 years of accumulated debris over an area that once was an old bird's roost. CDC reports that this fungus lives in the ground at higher rates in the central and eastern states of the USA, leaving these occupants automatically at a higher risk. Even more so if you live around the Mississippi River valleys and Ohio area, due to statistics stating 60 to 90% have been exposed in their lifetime, showing the highest fungal infection rates and mortality in the Midwest. Note that this is worldwide. It is condensed in different regions based on medical reports. This offensive fungi is called Histoplasma capsulatum, and it loves damp soil rich with organic material, making riverbanks and decaying trees suitable for incubation, but most commonly found around aviary pens and in bat droppings. Birds themselves cannot become infected with histoplasmosis and do not transmit the disease itself. When birds defecate, the soil becomes contaminated, and their droppings enrich the earth for the fungus growth. On the other hand, bats can become infected with the disease and has been proven to be transmitted through their fecal matter, making the soil in areas around caves and aviary pens highly infectious. Histoplasmosis is introduced to its host by inhalation of its airborne microscopic spores. As the body's temperature warms up, the spores in the lungs grow as yeast and then cause an infection. This infection can then snowball, creating severe or chronic problems, mirroring tuberculosis, traveling to lymph nodes, and dispersing itself throughout the body in the bloodstream to seed other organs in the central nervous system. Once in other areas of the body, it is called disseminated histoplasmosis and is fatal if untreated, making it necessary to start treatment with antifungal medications prescribed by a doctor. Patients are usually treated for a year or more but could result in lifetime treatment depending on the original state of health. Symptoms of histoplasmosis can vary from person to person and include fever, dry cough, chills, fatigue, headache, chest discomfort, muscle aches, spouts of confusion, joint pains, rash, while others may never show signs or symptoms of an infection. For those that do, their symptoms may appear in 3 to 17 days and only last a few weeks. It is recommended to rest, increase fluids, and use fever medication when necessary, mimicking the mild flu unless the infection becomes severe, chronic, mirroring tuberculosis, or has spread to other areas of the body. If coughing up blood or a lifetime of antifungal medications are not enough to suggest an extra step to routine, How about the scary tale of how histoplasmosis can remain hidden in the body for months or years before really showing its effects by building up in different areas of the body for the long haul, especially in the eyes? When the histoplasma enters the eye, it lodges in a layer of blood vessels that provide nutrients and blood to the eyes, known as the choroid. The fungus spores then start to cause abnormal growth. These abnormalities and swelling of the blood vessels cause lesions. If left untreated, the lesions ultimately start replacing the healthy retinal tissue with scars called histospots. If the affected vessels themselves move to the center area of the eye, they may affect a tiny region responsible for sharp, central vision, causing severe impairment and destroys straight-ahead vision. People that are living with active ocular histoplasmosis syndrome experience wavy crooked lines and blind spots. When it comes to our eyes, there are no early warning signs. Since exposure to the spores can cause complications years and sometimes decades later, best routine to take would be to start or continue yearly eye exams and checkups. Your eye care doctor can see and stop histospots from developing. Prevention. The best way to prevent exposure is to avoid situations that the spores can become aerosolized, airborne, and inhaled. Using proper work practices and dust suppression techniques will reduce the risk of infection. Always wear a mask. DHHS, NIOSH publication through the CDC suggests protecting workers with disposable and elastomeric, half-facepiece, air purifying respirators, but have found powered air purifying respirators are rated higher with farmers, grain handlers, and poultry keepers for breathing ease. For large projects and protecting workers at risk, check out the site. There is a NIOSH respirator decision logic table too. It will help you choose what's best for large projects and protecting workers at risk. For us backyard bird enthusiasts, I plead with you to start wearing what you have, a handkerchief need be. Your goal is to create seamless contact around your nose and mouth to avoid breathing in the microscopic spores in the dust. Leaks usually appear on the nose bridge in areas with facial hair, acne, or deep scars. When I was in 7th grade, I remember wearing a handkerchief cleaning the pens and sometimes would slip my shirt around my nose when the dust would freak me out. Honestly, it was before I knew what was in the dust. Just keep in mind with cloth and cloth masks, every time it is washed, the weave of threads are spaced further and further apart. Goggle up. To avoid exposure to dust and debris in your eyes, you will want to wear safety glasses. I prefer the anti-fog, dust, and splash safety glasses while cleaning my pens, but a tight-fitting strap could be more appropriate depending on the project. Reduce speed. Quick movements while sweeping or shoveling will inevitably kick up more dust. Slow down and take your time. Avoid windy days. If possible, try to avoid projects and activities that might expose you, such as cleaning aviary pens and disturbing contaminated soil on windy days to reduce breathing in the spores. Dampen soil first or mist water, called the wet dust suppression technique. This is when water is used and sprayed to wet the fugitive material so that it generates less dust. Extreme risk. As mentioned in the beginning, the high-risk group are those with weakened immune systems and are most likely to develop disseminated histoplasmosis. The high-risk group also includes children 2 and under, adults 55 and older, those living with AIDS or HIV, cancer and persons receiving cancer chemotherapy. Corticosteroid drugs, such as cortisone, prednisone, are long-term steroid therapy. Medications that prevent rejection of organ transplants. Rheumatoid arthritis medications that are TNF blockers, tumor necrosis factor inhibitors. Anyone receiving other immunosuppressive drugs. When to go to the doctor. Mayo Clinic suggests contacting your doctor if you develop flu-like symptoms after being exposed to bird or bat droppings, especially if you have a weakened immune system.
Thank you for taking time to listen to my article. There are very few health alerts for backyard bird enthusiasts, so I felt this was a significant tidbit to share as more and more folks begin embracing a once considered patriotic duty. I hope I was able to bring awareness and change a routine to help prevent any of the health risks mentioned above. And as always, folks, enjoy, take care, and stay grounded. This article file has been brought to you by Staying Grounded.